Maternal Health by Erica King and Celine Mai.
So, what exactly is maternal health? It is the health of women during prenatal, childbirth, and postpartum period. Services include prenatal care, delivery care, and postnatal care. Maternal health is often linked to maternal mortality. We'll explain more later in the video.
Why is maternal health important? Improving the well being of mothers, infants, and children is an important public health goal for the United States. Their well being determines the health of the next generation and can help predict future public health challenges for families, communities, and the healthcare system. The objectives of the maternal, infant, and child health topic area addresses a wide range of conditions, health behaviors, and health system indicators that affect the health, wellness, and quality of life of women, children, and families. Pregnancy can provide an opportunity to identify existing health risks in women and to prevent future health problems for women and their children. These health risks may include hypertension and heart disease, diabetes, depression, intimate partner violence, genetic conditions, sexually transmitted diseases, tobacco, alcohol and substance use, inadequate nutrition, and unhealthy weight.
In higher income countries, virtually all women had at least 4 prenatal visits, were assisted in birth, and received postpartum care. The postpartum period is divided in 3 stages, which are the initial phase, which is 6 to 12 hours after childbirth, subacute period, which is 2 to 6 weeks, and the delayed period, which can last up to 6 months. As you could probably guess, most women in developing countries do not get the same type of care as those in developed countries. Women living in developing countries have, on average, more pregnancies. Oftentimes, those women go through all stages of pregnancy without any professional care or proper sanitation. Factors preventing care include poverty, distance, lack of education, inadequate or lack of services and trained workers, and cultural practices. Mortality is death, but on a larger scale. Maternal mortality, defined by the World Health Organization, is the death of a woman due to complications from pregnancy or childbirth. An estimated 800 women die from pregnancy related causes each day, which translates to about 300,000 a year. The World Health Organization estimates that 99% of these deaths occur in developing countries. The top causes of maternal mortality that account for 75% of deaths are severe bleeding and infection after childbirth, hypertensive disorders such as high blood pressure, preeclampsia, and eclampsia, delivery complications, and high risk abortion practices, with most deaths occurring in developing countries. In the first image, we see a 2019 map of all the countries and their mortality rates. Over half of the countries are royal blue, which means the mortality rate is under 100 per 100,000 live births. Some countries in South America, Africa, and South Asia are light blue, which means their rate is 100 to 299 deaths per 100,000 births. The most extreme rate, which is greater than 1,000 per 100,000 births, are in red. Those countries are Sierra Leone in West Africa and Chad and South Sudan in Central Africa. The countries with the lowest rates under 10 per 100,000 births are Finland, Sweden, Greece, Iceland, and Poland.
Cost and accessibility of material resources around the world. This costing study was part of a quasi-experimental voucher study conducted in 2 districts in eastern Uganda to explore the impact of demand and supply-side incentives on increasing access to maternal health services. The provider's perspective was used and the ingredients approach to costing was employed. Costs were based on market prices as recorded in program records. Total, unit, and incremental costs were calculated. Why are mothers choosing alternative maternal health versus hospital care? Mothers choose alternative maternal health care options such as doulas, midwives, and birthing centers. During delivery, doulas are in constant and close proximity to the mother. They have the ability to provide comfort with pain relief techniques, including breathing and relaxation techniques, massage, and laboring positions. Doulas also encourage participation from the partner and offer reassurance. A doula acts as an advocate for the mother, encouraging and helping her fulfill specific desires she might have for her birth. The goal of a doula is to help the mother experience a positive and safe birth, whether an unmedicated birth or a cesarean. One of the main reasons women decide to use a midwife is to experience childbirth as naturally as possible. An additional benefit of having the midwife is their various payment options. Midwives often offer payment plans and sliding fees and are willing to accept most insurance plans, including Medicaid. Birth centers are for low-risk women who prefer to give birth without an epidural. Freedom of movement and non-pharmacological pain management methods will be offered and encouraged. IV medications may be available. If the mother ultimately needs an epidural, cesarean section, or any other medical technology, she will be transferred to a labor and delivery. All midwives who deliver in the birthing centers will work with the backup OB, who will take care of the mother if their delivery becomes more medical. New maternal health processes. What are some new maternal health processes? Planned Parenthood, fertility clinics, and IVF.
Identifying barriers limiting access to care and addressing them at all levels of the healthcare system is one way to improve maternal health care. Government funding in healthcare systems can make health options more affordable for low income women. Offering classes and training nurses, midwives, etc., in developing countries can greatly decrease the mortality rate. Big health organizations also need to focus more on developing countries, especially ones with higher adolescent pregnancies, which are pregnancy of women aged 15 to 19.
Raising awareness. No matter where in the world they live, all moms to be want what's best for their babies. A healthy beginning to a healthy, bright future. As a mom, I can definitely identify and agree with wanting the best health care for me and my baby while pregnant. I believe that if women and men would take more time to consider the extreme importance of maternal health care, it would definitely help turn the world's attention to the vital need for the basic, low-cost care that can make the difference between life and death for moms and babies globally.